Welcome back. I'm Barbara McGinnis with Takacs McGinnis Elder Law Hour. Like always, we're here today to talk about the issues related to advanced age, chronic illness, and unexpected illness and disability. Particularly in today's episode, we're talking about resources for low-income and low-net-worth seniors.
Right, and I'm your co-host, Tim Takacs, and we're talking today about with Sara Jane Glynn, Director of the Area Agency on Aging and Disability, AAD. Yes. Tell us about that program. What is it?
Yeah, so I work at the Greater Nashville Regional Council, which is also known as GNRC, also known as the Regional Council. We've got a lot of different names. And GNRC was created by the Tennessee State Assembly in 1965. And our role is to help administer state and federal grants on behalf of local governments. So we serve a 13-county region here in Middle Tennessee. And there's a number of different areas of support that we offer. So economic and community development, policy planning, and program assistance, but my role is really working on aging and disability. So the Tennessee Commission on Aging and Disability has designated us as the local area agency on aging. And I realize that's a lot of words that don't really say a lot. So
AAAD.
The AAAD. So what that really means, once you sort of clear away all the acronyms, is that we help develop plans for the region, and we help to coordinate programs and services for older adults and people with disabilities who are living in Middle Tennessee.
Okay, so now there are several AAADs in the state of Tennessee, and GNRC is just one of them.
We're just one of 9 across the state. That's right.
Okay, so there are your counterparts all over the state.
Yes.
So because our viewership is wide here.
Oh, absolutely. So if you live in one of the 13 counties that GNRC covers, you would call us. But everyone in the state is covered by a AAAD somewhere. And I will say they are phenomenal people. I've met folks from across the state. So if you're not sure who to contact, I know our number's coming up. You can call us and we'll direct people to the right place.
Great.
Sometimes the challenge for a family is really just where to begin when a crisis hits. How does the AAAD help with that?
So one of the starting points for a lot of people is our information and assistance program. So we have a helpline that is staffed by an incredible group of people who are astoundingly knowledgeable about just about everything you could need to know in terms of supports and services for older folks or people with disabilities. So if you call into the helpline, one of those staff members will help you figure out where you can go next. Do you qualify for a federal or state funded program? They can help screen people into those programs if they do qualify. And they can also help make referrals to a variety of other supports that are available for folks in Middle Tennessee. And we can also help connect people if they're outside of this region, help them connect them to the supports and services where they live.
Great.
So we learned a little bit about the Choices program from Chris Coleman. He mentioned about GNRC and how it helps seniors, or basically families who are trying to get choices. Tell us a little more about how that works.
Yeah, so Chris gave a great overview of Choices and how it works. And GNRC works with TennCare to help figure out who might be eligible for the program and help screen them into it. So we have a really dedicated staff of folks who will go out, like Chris said, they go to people's homes and they meet with them.
So walk us through a typical phone call.
Yeah, so let's say somebody calls the helpline, and as part of that conversation, they figure out this person, is Medicaid eligible, they need help with long-term supports and services, they might be eligible for Choices. So then that individual is going to get a call back from someone from within the Choices program, and they're going to set up a time to come out to their home and meet with them and walk them through the process. So, anyone who's ever applied for anything that involves the government knows it can be really complicated. There's a lot of documentation involved. Chris mentioned some of this. There's financial requirements. You need to have medical documentation. It can be really overwhelming for people and their families. And so what our folks do is really help people navigate that. By working really closely with TennCare, we can make sure people are able to go through the process from beginning to end and access the services that they need.
Great.
So that's Choices, but there's another program called Options, and that becomes even more confusing, right? So tell us, what's the difference between Choices and Options, and how do you exercise your option?
So Choices is a federally funded program, and in order to qualify for it, you need to be Medicaid eligible, and you need to require the level of care that would otherwise be provided in a nursing facility, right? Options is for folks who may not qualify for choices, but who still need help to stay in their homes. And for a lot of people, it's a program of last resort when they're just finding it very difficult to stay in their communities and stay in their own homes. So we at GNRC also help screen people for this program, the state program that provides assistance to people who live in Tennessee and who, you know, have difficulty caring for themselves or caring for their homes. So we help people through that process so that they can access the program, and then we also help them to actually coordinate those in-home services, whether that's care that they need for their own personal needs or if they need help taking care of their homes. Either way, we can help coordinate.
How do you
that
qualify for options?
It is a complicated, it's a complicated formula, but it's based on how much need somebody has.
Okay. I'm just thinking, is there a resource test or an income test like choices, or I assume that there is, and we probably don't want to get too deep in the weeds here.
I would say if folks think they might need the program, to call in and we can help walk them through it.
Call any of the AAADs.
Yes, absolutely.
Great. Okay, so what about the Family Caregiver Services Program that we've heard about?
Yeah, and this is one that I love talking about because I think family caregiving is so valuable and so important, and it's also really hard. It's very taxing on caregivers, and I'm sure many of your viewers are well aware of this because most of us will be caregivers at some points in our lives.
Right.
So this program is another federal program, and it's used to provide support services to the caregivers themselves. I think a lot of times we're focused on the individual who needs care, but this is really about helping the caregiver and helping provide them with respite services so that they can take care of their own emotional and physical health at the same time that they're taking care of a loved one. And I think it's really important because it's not just about making sure people are rested. It's really about creating a whole home environment where everybody is healthy and well taken care of.
Is there criteria for this as well, like income, assets, or is it similar to options? Or?
It is based both on the level of care that the individual needs and then some factors about the caregiver as well.
Okay, it's just so there's screening basically.
There's screening for all of the programs.
Gotcha.
Yeah.
Okay.
All right, so there's another way that you help seniors with Medicare, right? Open enrollment's coming up, and if you're confused about your Part D plan, or they can call and talk to someone about Medicare.
Yeah, so GNRC also houses the SHIP program, which is the State Health Insurance Assistance Program, and now is really timely since open enrollment is coming up very soon, October 7th through December 15th. And this program provides free, unbiased information about Medicare to anybody who wants to learn more or who needs help. And it's staffed by a combination of folks who are in our office at GNRC, and then also an army of really dedicated and amazing volunteers who help out as well. So this program is so important because there's no agenda behind it. It's not about pushing people to make particular decisions or to buy this or buy that supplemental plan. It's really just about making sure people understand the system that they're navigating, all of the options that are available to them. The assistance programs that Chris mentioned, we can help people figure out if they qualify for those and to get them started on their application process there. And it has real impacts on people's lives. You know, there was a gentleman who called and talked to a colleague of mine. His prescription drug coverage was changing, and it was going to cost him almost $21,000 a year to cover his medication. And my colleague walked him through his options, and he found a different plan where it was going to cost him $200 out of pocket. So she saved him $20,000 with one phone call. And like I said, this is not about trying to get people to purchase any particular plan or make any particular decisions. It's just about helping people have the information they need.
We're talking with Sara Jane Glynn, Director of the Area Agency on Aging and Greater Nashville Regional Council. We're going to put your contact information up. And thank you, Sara Jane, for being here. We appreciate your being here, and with all the other guests who have been here. Thanks for tuning in to this edition of Takacs McGinnis Elder Care Law Hour, when we talk about aging, disability, and unexpected illness.
And if you want more information about today's guest or some of our past episodes, you can go to our website at tn-elderlaw.com. And until next time, when we'll be back to talk about more aging issues.